To talk more about what this sudden change in guidelines in Metro Manila will mean for hospitals, we have with us Dr. Rontgene Solante. He is the head of the Adult Infectious Diseases and Tropical Medicine Department of the San Lazaro Hospital in Manila. Good evening, Dr. Solante.
Good evening, Robbie.
Sir, yesterday people were told, anticipate a return to GCQ. Now, essentially, status quo tayo at least until September 15. How are you receiving this news?
Well, this is a good break for us. Not necessarily a break because we see this surge of cases has been going on since last week of July until now, and this is the longest surge of cases that we have experienced. Our ICUs are still full for almost 1 month and a half now, and healthcare workers are also getting sick. So hopefully with this 1 week extension of the MECQ, we can see some improvement. And most likely, if they would really want to put the granular lockdown, then they have to implement the granular lockdown now in a setting that there's also an MECQ. That's just my thought.
But in the meantime, sir, apart from the wisdom and the dilemma that nobody will discount, no? It's a real hard decision. People are also asking, itong pabalitan ng policy and strategy, they're wondering, ano ba, napag-usapan ba to when it was announced, for example, that we will finally we will finally transition to GCQ. What was the discussion heading into that? And why is it so easy to then reverse that decision again?
I think, again, this is my personal view. Observing by the current rate of how our economy has been going on, I think the importance of really reviving the economy is the #1 objective, why we are into a granular lockdown, despite the enormous number of cases. I fully agree with that. But again, there should be close consultation with healthcare workers, especially we in the ground, who are really taking care of these patients. And it's a situation that I would see. If there will be a continuous number of cases like this, I don't know what happened 1 week or 2 weeks from now.
Okay, speaking of what's happening on the ground, even the WHO is reminding, and a lot of health experts, and LGUs, and even the IETF had said one thing about granular lockdowns as we shift more burden to the local governments is we still need to keep on top of tracing, and we still need to improve contact tracing and the sharing of information and data across borders. How are we doing on that front? And if you take it by that gauge, are we ready for a granular lockdown?
Robbie, I'll give you an example. We have patients who has been symptomatic for 5 to 7 days, then brought to the hospital on the 8th day, tested on the 8th day, positive on the 9th day. Contact tracing, not existing. 7 days, 6 days, patients who had contact with household, those contact also going out, and you see the enormous implications of that particular setup. The time from detection to isolation is still very long. So that's why there is doubling of cases because of this situation.
Okay, maraming salamat po, Dr. Solante. That was Dr. Rontgene Solante, head of the Adult Infectious Diseases and Tropical Medicine Department of the San Lazaro Hospital.